We discussed combining points, principles, the channel system dynamics. After identifying the patterns and formulating a plan of treatment, the next step for an acupuncturist is that of the selection of points to use. There are two different considerations: the selection of points according to their action, the combination of points according to channel dynamics. In other words, in order to give an effective acupuncture treatment, it is not enough to select the points according to their individual characteristics and energetic action. We must also be able to combine points harmoniously according to their action within the channel system. Acupuncture works via the channels, not just via isolated points, so that each point should be considered not only for its individual action, but also for its place within the channel system. Even if we master the action of each individual point, this is still not enough to give an effective acupuncture treatment, as each point must be seen not in isolation, but within the dynamics of the channel system so as to attain a harmonious combination of points. For example, one might treat spleen qi deficiency and liver qi stagnation by tonifying bladder 20 and bladder 21 and reducing bladder 18 and bladder 19. Although technically correct from the point of view of energetic action of the individual points, it would be an unbalanced point prescription as all the points selected are on the back. To give another example, one might treat liver and kidney deficiency by tonifying kidney 3, liver 3, spleen 6, and kidney 6. Again, this would be correct according to the functions of the individual points, but also rather unbalanced as all the points are on the distal part of the legs. The balance of the point combination is essential to the success of an acupuncture treatment. Indeed, a balanced point combination is as important to the therapeutic result as the needling technique. The latter is, of course, very important to the success of an acupuncture treatment, but the harmonious combination of points is often overlooked. They are both important because they reflect two different viewpoints. In a way, the stress placed on needling technique is based on a point-centered view of acupuncture, while the stress placed on the combination of points is based on a channel-centered view of acupuncture. Both of these points of view are important and both need to be taken into account. So the stress placed on needling technique is based on a point-centered view of acupuncture, while the stress placed on the combination of points is based on a channel-centered view of acupuncture. Although the needling technique is indeed very important, we should not place too much stress on it. In fact, when the point combination is harmonious, we bring into play the circulation of qi in the channel system so that qi is moved effectively, somewhat reducing the need for vigorous needling manipulation. For example, stomach 40 is said to resolve phlegm, and in case of a severe phlegm pattern, we should needle this point with a reducing method. The more full the condition, the stronger the reducing technique required. However, resolving phlegm with acupuncture involves a lot more than simply reducing stomach 40. In particular, it involves regulating the qi mechanism by harmonizing the ascending, descending, and entering, exiting of qi. Acupuncture can resolve phlegm only by regulating qi. By combining stomach 40 with other points according to the principles outlined, the movement of qi is encouraged by the communication among the points rather than just by the stimulation of one point. The combination of points also regulates the ascending, descending, and entering, exiting of qi. For example, in order to resolve phlegm, stomach 40 could be combined with lung 7, ren 12, ren 9, bladder 22, and kidney 7. Apart from the fact that the other points also contribute to resolving phlegm, such a combination balances yin with yang points, as well as points on the arms with points on the legs. Thank you for listening.